Good morning, everyone. My name is Terry Belcourt. I'm a nursing advisor here at the SRNA. Welcome to Webinar Wednesday. This is our first session for the fall of 2017. And I'm excited to be joined today by Anne-Marie Urban. Anne-Marie is going to do this session for us. It's a repeat of a session she did during our conference day for 2017. We're also joined by Tony Geruzzi, who is our IT support, and he'll keep us running smoothly through the day. So thanks very much for taking the time to view this webinar. And without further delay, I will hand it over to Anne-Marie.
Hello, everyone. As Terry said, I'm Anne-Marie Urban, and I am faculty at the University of Regina. I've been practicing nursing for almost 30 years. Was in clinical practice and then came over to education in 2000. So today's presentation, as Terry said, is a repeat, but a bit of an extended version of the session that I gave for any of you that were at the Education Day in Saskatoon in May. So welcome, and thanks so much for taking time to listen today. So just a bit about the background of how this came to be. This study is, what I'm going to talk about afterwards, relates to the work that I started with when I was working on my doctoral studies, and looking at the nurses' environment. And what really struck me was what nurses were saying about their own physical and mental health, and sort of how that the environment that they worked in affected them. So I'm going to give you a bit of background about that, sort of what took me there, a bit of background and context about today's nursing environment, and talk about the study, and then we'll talk about the recommendations around that. So I'll just give you a couple of seconds here to think about these questions. So, and who you are, and sort of what your role is, and why you're participating today. So, as I mentioned, this work stems originally from the doctoral work that I did, and as I mentioned, I wanted to unpack more of what nurses were saying around their physical and mental health. So as all of you know, the hospital environment is really changing, and is changing in a very rapid, dynamic way. And that has a lot of impact for what we do as nurses, especially those that work in acute care settings or with patients, or anybody that works as a nurse will see impacts. And what we're seeing a lot from our work are the impacts to nurses' mental and physical health. So the hospital environment is what I would consider to be coined as a dynamic environment. It's always changing. Nothing ever stays the same. We're seeing implementation of change almost continuously. And we're really having a lot of fiscal constraints. We're hearing a lot about budget cuts, which impact, of course, then the work that we do. Most hospitals today are running over capacity, more than 100%, and that's having, again, an impact on where we're doing our care of patients. We're seeing increased patient acuity, and I'm going to talk more about that when I talk about what the participants talked about, but in terms of patient acuity, we're seeing different patients. So patients coming in, presenting with more chronic conditions. We're seeing a multitude of conditions, and we're seeing patients that have a lot of mental health and social issues as well. As well, in that hospital environment, we're seeing a lot of expedited processes. So because there are overcapacity issues, we want to have the patient move through, or the patient needs to move through the system quicker. And that, of course, has an impact on the work that we do. And of course, then there's staff shortages around that, and that's at all levels. And within that environment, because of the dynamic nature of it, it's always changing, nothing's ever static, lots of things are going on. There are, of course, conflict that can happen. So just some statistics before we carry on. So what we know, and this is from CIHI, or the Canadian Institute of Health Information, 90% of RNs, NPs are female, and that's been pretty consistent over the last, since we've been around, basically. The number fluctuates a little bit, goes down, but it's pretty much staying around that. The most recent data that I found from CIHI said that 78.8% of RNs and NPs are employed in hospital settings. So still, the majority of nurses work in hospital settings. And because of the nature of the work, RNs are especially high risk for experiencing physical and mental injury, which is known to influence the delivery of safe, quality patient care. So the work that we do, of course, just by the sheer nature of what we do, it's fast-paced, results of lifting, there's things that can happen. As I said, conflict, we're dealing with stat situations, or we're dealing with palliative situations. So all that can impact us emotionally as well. Nurses' health issues contribute to suboptimal patient care, including medical errors, a decrease in patient satisfaction, increased turnover, and increased absenteeism, a decrease in performance, recruitment, and retaining challenges. And these are just, again, the facts that we know about how the health of nurses impacts then what we do. So just a little bit more about nurses' mental and physical health. Specifically, when I looked at the data, the most prevalent or problematic physical and mental issues that impact nurses are, of course, musculoskeletal problems. That makes sense given sort of the repetition. We're walking on floors that are hard. We're doing a lot of lifting. So we're working with heavy objects, so of course musculoskeletal problems, and then from that we have pain. So again, repetition, or from those musculoskeletal problems, or just from the work that we're doing. The other two that we're seeing more of are anxiety and depression, and in the last about 6 to 10 years, we've seen that really is escalating. Some studies, as the second bullet says, suggest as many as 2 in 10 nurses suffer from depression, anxiety. And because of the mental and physical health issues that nurses have, we're seeing a high absenteeism and disability rates. The rate of absenteeism for public sector healthcare nurses working full-time is substantially higher, and that's at 9%, than of all other occupations, which is around 5.7%. And when I looked at, a report came out that was prepared for the Canadian Federation of Nurse Union by Jacobson Consulting just not too long ago, but they talked about the Saskatchewan absenteeism rate. So in our province, in 2014 it was around 6.9%, and in 2016 it went up to 8.5%. Long-term disability for RNs and RPNs, so registered psychiatric nurses, about 50.78. So we're seeing those numbers that were escalating. And as I said, so those musculoskeletal injuries, and this information comes from 3S Health, here in Saskatchewan, that does the insurance for unionized RNs and RPNs. So musculoskeletal injuries, specifically soft tissue injuries, joint injuries, bone injuries, but that did not include autoimmune disorders. And in terms of the mental and nervous disorders, how they classified that was according to the DSM classification system, and that's a category of mental health disorders, so anxiety disorders, depression, etc. And in their reporting, they also talked about the medication. So the highest or the most medications that were being prescribed were related to blood pressure, and that was around 25%, and depression around 14%. And the procedures that were most reimbursed were for massage and chiropractor appointments. And I just sort of share that with you to give you an idea when you think about physical and mental health. And as I said, musculoskeletal disorders, MSDs as they're classified as, such as low back pain, are linked to physical, psychological, and social factors. And you can see that all of that, it's not just the physical pain, it's all linked, because everything, of course, then compounds to, if I can't do something, then of course I'm going to be maybe not thinking as well, or I might be down. And of course, that might impact then what I'm doing, maybe with my family, etc. So, of course, they can impact other health outcomes, and especially depression and burnout, which would make sense. So, again, that overlapping environment that most nurses work in, so that acute care environment, and nurses' illness and injury. Research concludes that workload and expediting work processes result in workplace injuries and errors. So over the last 10 years, we've seen, because that environment is really become a lot more dynamic, and there are the overcapacity issues, and we've got people on waiting lists that, we need to expedite certain processes and move people through the system, and that is resulting in, of course, injuries and errors because of that need to get people through and to move quicker. We're not doing sort of that slow, able to reflect, not having the time. So the ability of RNs to maintain their health is imperative to providing safe, quality patient care for nurses' overall wellness. And I just say that sort of as something we all know. The literature, and I'm not going to get into it too much, just to share with you that there's just an enormous amount of literature that speaks to, how nurses are at risk for illness, emotional exhaustion, and musculoskeletal injuries because of their work. We have that data. We've known this for more than 25 years. There was a big thrust of research that came out after the restructuring in the 1990s that really clearly aligned the environment with injuries that came out, and we've sort of seen that continue going on. Research has made it clear that problems with the nurses' work and the work environments, including stress, heavy workloads, long hours, injury, and poor relations with other professions, can affect their physical and psychological health. And I just took out these two quotes because I think that they are really sort of capture those connections to our health and to the environment. So why is this important? While hospital conditions are widely known and regularly discussed, little has been done that directly supports nurses' overall health. And when I talk about nurses' overall health, I'm talking again their mental and physical health. Since about the 80s, there's been a lot of support within the acute care environment for, let's say, lifts and more back programs, but the two together there hasn't been a lot that has been done. And there still is this reactive versus proactive approach. So giving you examples, so nurses become injured and then we do something after the fact versus doing something upfront. Okay, let's look at how we can sort of manage this before it even happens. Nurses' well-being is important, and if they cannot work or if patient care is affected by their ill health, patients and hospitals will be impacted. And of course, like I've said, the absenteeism rate, economically, all of those things. We won't have the staffing problems. So now I'll get to the study that I did a couple of years ago. So I did this study with a colleague from business, Dr. Wallace Lockhart, and he has a real, what I would say, sort of affinity for nurses' work. His doctoral work was around physicians, and was interested in as well sort of unpacking these things with me. So the study was undertaken to understand how hospital conditions impact registered nurses and registered psychiatric nurses' physical and mental health, as well as to identify solutions to support their health and their efforts to provide safe, quality patient care. So I'll just talk about how we went about doing that. So we wanted to, again, look at in the context of how do we, how are they able to provide safe quality care and still sort of manage their physical and psychological health. So we conducted 5 focus groups, and we did those at the SRNA AGM. Maybe some of you were involved in those focus groups. We did them at the RPNAS annual meeting, and we did them at the SUN annual meeting. So we did 5 focus groups, and there were anywhere from about 6 to 7 people in the group. So we had about 32 nurses shared their experience and ideas, and they lasted for a little bit over an hour, and some really interesting discussion resulted from those focus groups. And then from the focus groups, there was 5 themes that emerged from the data, and I'll speak more to those. But those 5 themes were staffing, the generic patient, physical and mental aspects, managerial support, and time to debrief. So now what I'm going to do is each one of those themes, I'm just going to share with you some of the participants' comments, because I think that those are more powerful than me could have speaking about data, and they give you a real sense about what people are saying. So theme number 1, the staffing. So somebody in one of the focus groups said, in terms of physical health, when you're short staffed, it puts yourself at a safety risk. You don't, yourself and your patients are at a safety risk. In an incident happens, if an incident happens, you don't necessarily have the people around you to help you deal with it effectively and safely. Another person said, you're supposed to have 6 nurses and the charge nurse, and they had 4 nurses and no charge nurse. So immediately that puts you at a safety risk, a physical safety risk, and an emotional safety risk. So you can see how they were talking about how that impacts, again, their physical and mental health. And just a couple more quotes here. 1 to 4 makes a big difference, because then you're thinking, I've only got 4 patients today, physically and emotionally draining, and to take on 3 part of care plus 5 patients at 1 to 5, it's just not practical. It's not just the nurse. It's not nice for the nurse. It's not just the physical care. It's the mental stuff that goes, the health, the emotional stuff from the family, the 20 questions. And a lot of nursing staff has said it has made their life very hard for them. And lastly, people cost most, but in the long run, it will actually be cheaper. You'll save money on decreased sick time, and that doesn't even count any of the better patient outcomes and the other things research already shows. So talking about it would be better to have more staff and put out that cost out front. So theme number 2, and I'm just going to briefly speak to this. What I sort of put together as the generic patient, because they're still on a lot of units. They talked about that there's this geographical assignment. So Anne-Marie will look after from room 1 to 4, rather than looking at the individual patients and sort of what their needs are, sort of grouping them all together. So you have, you might be caring for somebody who has a lot of needs, or who has, their isolation, or bariatric patients who have different needs, or you have patients that have a lot of comorbidities, lots of drains. There was different needs. So, but that wasn't sort of put into how that assignment goes up. So, as one person said, as soon as the acuity goes up, whether it be due to short staffing or staff having acute patients or those kinds of things, that put you emotionally and physically at risk. Physically at risk for being hurt, for being exhausted, because you're going from a caseload of 5 to a caseload of 7 or 8, depending on the patients. You're not able to take proper breaks to really take care of yourself. Then what do you have left for your patients? And all you're busy doing is really just making sure everybody is okay, and that's it. You're not able to take care of that psychological or physical health. One thing that I see on the surgical floor, and this is in most jobs, is that when they make the patient assignment, when you're talking about the LPN and the RN, it just seems like the unit is split in half, and there's no consideration for the acuity of the patient. So that always concerns me, that they just say, this end is for the LPN, and this is for the RN. And they're not really looking at the acuity of the patient. So again, speaking to that geography. So there's this expectation that every patient has the same needs. Theme number 3, physical and mental aspects of the work. The other thing is the expectations of our job to move clients. Are you kidding? I refuse to lift a 50-pound box. I refuse to lift 20 pounds. But you know, we are in a helping profession, so I'm lifting that box anyway. That's not the client's expectation, but we are stuck with it. Who is going to do it? That's my physical thing. It's stressful. Stress affects me over time. I don't work shift work, so I can't even begin to talk about that. But I have in the past, and I know how stressful that is on top of that. There's been lots of literature and research around the impact of stress on blood pressure and on all kinds of things. So, you know, they have, these participants we're talking about, they have the awareness, they know, but they still have to do this work. Looking at physical health, I'm not physically healthy, I'm overweight, and I believe a lot of that is I run all day. I should be skinny, but I'm not because I don't get regular breaks. I don't stop. I don't have a coffee break. So I'm trying to take my lunches in my bag that I carry. I'm not healthy, and I'm lazy when I get home. I'm done. I sat at the group of nurses. I sat down at the group of nurses, and I was surprised at how many in this small group were on antidepressants or anti-anxiety medications. I was just shocked at the number of staff members. And then managerial support. I think it's a lack of communication. If you're going to be a manager, you need to be aware at least of what's going on. What are you doing this month? It would be really nice. No team meetings, no client conferences. So this person wanted, obviously, some connection there with their leadership. I know in our health region, we presented to our senior management, and we were told basically, yes, so we're not doing anything. We came up with a couple of different models of care that were going to be cost savings and thought that was going to be better and allow us to provide better nursing care. And we were just told, well, that's nice, and that was it. So it sounds like this person believed that their ideas weren't being integrated into improving that environment. I would say another point is rapport with your manager. If you don't have a good rapport with your manager, I think your job satisfaction is pretty low, and you're probably going to exit that unit, or you won't feel the commitment, responsibility, accountability, etc. Time to debrief. Now this, I would say this and staffing were probably what we heard the most about. I don't feel that there's a process for debriefing. For example, if you're involved in a code, you're probably not going to get debriefed. Even if it's kind of traumatic, you're going to have to go home and deal with that. If you have a rapport built with other nurses who are involved, you'll be able to discuss it with them, but there's no formal debriefing. I've been in one debriefing situation, and that was very helpful, but all the other traumatic events, you're expected to deal with it and shrug it off because there isn't any time. You're all that's working, and you're probably, you were probably, all involved in the event, so there isn't a process for debriefing, and I find debriefing to be helpful in those situations. And that's how you can really learn from a situation too. If you're in a code, to debrief what went well, what went not so good, and then to learn for the next time. Otherwise, you might just have questions in your head that go unanswered. And one more quote, we aren't involved in any debriefing, they're just the nurse upstairs. That's what we do. I supported the unit staff, but we do not, or we do it anyways because that's what brought us into nursing. We care about our patients. So from those 5 themes, I just wanted to sort of capture what I thought were sort of the most powerful. There were a lot of other ones, but those I thought were sort of capture what they were saying in terms of those themes. So then as well, we asked them in sort of our final question was, okay, so given how these things impact your physical and mental health, so what kind of things do you think would help? Some things that they noted was implementing strategies in hospitals and developing policies, and I kind of captured this one together. So again, talking about the strategies and having, I guess, the infrastructure, developing those policies that foster a culture which supports nurses in maintaining their physical and mental health is key to positive health, patient outcomes, reducing nursing absenteeism, injuries. And I put that together because what I heard from them was how much the patient always came first, what they were doing. They were willing to sort of what I would call sort of sacrifice their own physical and mental health because that's what they knew really sort of guided their practice. They were doing it for their patients to make sure that their care needs were met, their own the patient's own physical and mental needs. So kind of then theirs fell by the wayside. A lot of them talked about a formal debriefing process. And I talked to some people that are in practice, that there used to be a critical stress incident process. And there is that service, but to have even just even that time when there is an event that happens, okay, can I just take a moment here to sort of reset and sort of kind of work through what went on. But given the nature of the environment, that it continues even after those situations where there's crises, where there's codes, where there's stat events, where there's conflict, we continue. So it's difficult to have those moments to kind of just process. To have nutritious available food at all hours, so during the night, especially people talked about that. Mental and physical programs, so having ongoing programs that would support them, so sort of not just what I want to say, something that they read about, but that this was sort of part of the culture that they work in. So whether it be lunch and learn, whether it be online, but that there is there's programs that they could learn from specifically around stress, conflict management, and maybe even if they could have some gym membership, because they talked about, they wanted to be more physically healthy, and even learning about nutrition, some of them talked about. Many of them mentioned recognition. So just even knowing that they were valued for the work that they did, even having somebody kind of pat them on the back. We talked about a secret PAL that we did many years ago when I was working in acute care, where we picked names for anybody that wanted to be involved, and sort of had this secret pal that we had throughout the year. And those were even nice things to kind of even increase the morale and just know that, hey, somebody was kind of looking out for you. And teamwork and education, and just even having supports around that. What does teamwork look like when we're in a conflict environment? What does teamwork look like when it's a really fast-paced environment? So just even some education to talk about that. Of course, related to staffing, a lot of them asked, about staffing and how, that was something that really came out, and the need for more staffing. And just there's been numerous studies that talk about patient ratios, and but one that I found interesting from Duffield and colleagues was a 5-year longitudinal study that showed that nurse staffing, fewer RNs, increased workload, and unstable ward environments were linked to negative patient outcomes, including falls and medication errors on the medical and surgical units that they were on. So I think it's one thing that is really important is to connect nurses' mental and physical health in relation to patient outcomes, making those two connections really strong. Evidence supports appropriate patient-nurse ratio, mentorship programs, critical incident debriefing, stress management orientation, and ongoing education programs, which would serve to minimize absenteeism from ill health. And I'm just going to put in a plug for all of us, because I think it's really important, besides having a culture that fosters all of us, our physical and mental health. I think it's also really important that RNs, that we take responsibility, that we have actions that can monitor our own physical and mental health. So what am I doing to keep myself healthy? If I am having trouble processing something, what can I do about that? If I'm feeling really tired, what can I do about that? If I'm not sleeping, those kinds of things. RNs are known for working long hours, especially overtime, more than 40 hours per week consistently, and 2/3 were working without taking breaks. And studies have shown that. Trinkoff and colleagues as well did a study that provided evidence for that. And I sometimes, and I know I'm guilty of this, and I'm not sweeping everybody with the same brush, but I think we need to be really cautious of everything for everyone, and just realizing that, we need to put parameters on what we can do. And again, sort of my messaging about self-care, I think it's really important. So thinking about burnout, education, work-life balance, adjustment of one's relationship to work, and knowing that, okay, I need to sort of set that aside. What can I control? What can I let go of? Mindful practice and the acceptance of our clinical work environment, sort of given the nature and knowing what it is. There's a lot of work right now that's around resilience, psychological resilience, but just to really stress that it's a process, that these things just don't happen. We've come to a certain place in our life, and now we have to learn different ways of coping, of processing things. And I love this quote by Carl Rogers, who is some of you might know, a well-known psychologist, who said this, if you can believe it, at age 75. I've always been better at caring for and looking after others than I've been at caring for myself. But in these later years, I made progress. I thought that was kind of great. There is always, we can always get better as we age. So some final words. Most importantly, RNs must be aware of other possibilities and they advocate for change. They must realize that they do not have to become injured, stressed, or leave the profession because of the lack of supports. And Terry's going to talk a little bit about sort of what those supports are. But in terms of other research, further research could include pilot studies and implementation of best care models, all of which could be supported by regulatory bodies, unions, government, and healthcare organizations. So I think it's really important as well to advocate and to know sort of what can we do. So exposing what the issues are, talking about those, and then championing for best practices. Again, putting that in the context of our patients. What I heard again from the participants in the focus groups was around the patients. So, talking with others and giving voice to others for maybe people that, don't know how to do that. And again, advocating for physical and psychological safety in your workplaces, using those processes. And for those of you that, are working through your competencies right now, number 74 I thought was really fitting with this presentation. Recognizes the impact of organizational culture and the provision of healthcare and acts to enhance the quality of professional and safe practice environment. And I don't know, Terry, if you want to just mention something there.
Yeah, the information that you've given it really does help you to reflect on, what kinds of things work well in the environments and support that positive, healthy work life. And some of the things that maybe contribute to more of the negative situations that are really draining on our health can be physically, because we know that if we're mentally exhausted, it does exhibit in physical ways as well. So some of the things that really jumped out at me was making sure that there are good lines of communication with managers, with each other, and dealing with some of those situations, conflict situations that contribute to more of a negative environment. And there are lots of different resources out there. There's, I think everybody has access to EFAP, the Employee Family Assistance Program. I know that they will come out and do group sessions. So maybe there's the opportunity to invite somebody in to talk about communication or conflict management, something like that. Building it from within, showing that leadership that each of us have. Sometimes it's easier to do it if you've got, a couple of like-minded people who also see the issue and bring it up at a staff meeting, or if you don't have staff meetings, to request them. I think really that open communication is really critical to helping support all of this. When you want to talk about staffing issues then, or some of those other things that aren't going well, it's easier if those lines of communication are open. So those were, thank you.
Okay, so I guess if anybody has any questions, or any comments, you can feel free to contact me. I'm at the University of Regina, or Terry. Yeah, so thanks so much for listening.
Yes, thank you very much, Anne-Marie. And absolutely, if there's things that are going on within the workplace and there's a practice advisor that can help shed some light on and provide some insight into how to move on with that, we're always happy to hear from our members. So practice advice team is always available to take questions. So that would be great as well. So thank you very much for this presentation. Very good. I'm really glad that you came in today to do it. I wasn't able to see it at the annual meeting, so I think there'll be a lot of people that are interested in this research and having some, here's the study, here's the evidence. If you can't access that directly, going through SHRP or some kind of library within your health region, you can get those studies as well. So just a couple final words. This is the first of our fall series again. And so coming up, we've got sessions about reg renewal questions, continuing competence, our specialty practices, our comp assurance process. So there's lots of great information going to be rolling out every Wednesday between 9 and 10 a.m. From now until mid-December. So hope to see you live sometime during one of those sessions. So thanks again, Anne-Marie, for coming in today. Have a great day.